Most pancreatic cancer diagnoses in older adults are not made from a symptom. They are made incidentally, during a scan for something else, when treatment options are already limited. The 12 symptoms in this video were there before that scan, for months, and nobody connected them. The assumption most people hold about cancer is that the body announces it in a way that is unmistakable, that something will happen that sends you to a doctor who then finds the problem. Pancreatic cancer does not work this way. It produces symptoms that are individually indistinguishable from dozens of benign conditions, each plausible on its own, none of them alarming enough in isolation to trigger the investigation that would find the real cause. Subscribe before we go through the list. This channel is built for the person who is already paying close attention to something and has not said it out loud yet. The thing that people close to this cancer describe most consistently is the experience of looking backward, of sitting in the room where a diagnosis is delivered and recognizing in the same moment that the back pain from September was not the new chair, and the itching from November was not the dry winter air, and the tiredness that arrived in summer and never fully left was not the schedule. Each symptom had received an explanation that was plausible in isolation. Nobody ever looked at all of them together and asked what they were pointing to as a cluster. That is what this video exists to help you do before that room, rather than inside it. Here is the structural problem. There is no recommended population-wide screening for pancreatic cancer, no equivalent of the colonoscopy or mammogram that brings people in at an early stage. The only pathway is a patient describing something specific enough that a referral follows. Research published in Lancet Oncology documented that the median time from first symptom to pancreatic cancer diagnosis is between 6 months and a year, and that the majority of patients had presented to a doctor with at least one symptom from this list before their diagnosis, at an appointment where that symptom received an alternative explanation. Before the symptoms, the most important thing in this video. Every symptom on this list has other causes, and most of them are benign. Most people who experience any one of these symptoms do not have pancreatic cancer. The purpose of this list is not to create alarm about isolated symptoms. It is to create recognition when 3 or more symptoms from this list are present simultaneously in the same person over weeks to months. That cluster pattern is what changes the clinical picture. If you notice one symptom, note it. 3 or more, see a doctor this week. And symptom 1, jaundice. Yellowing of skin or eyes warrants prompt evaluation on its own, regardless of other factors. Painless yellowing of the skin or whites of the eyes. Jaundice is the best known sign and the one most likely to produce prompt medical attention. It occurs when a tumor in the head of the pancreas obstructs the bile duct, causing bile to back up into the bloodstream and deposit in the skin and eyes. Crucially, it is often painless, which leads people to assume it is temporary. Painless jaundice in an adult over 60 warrants same-week medical evaluation without exception. Symptom 2, a deep, persistent ache in the upper or middle back. The pancreas sits directly in front of the spine. As a tumor grows, it can press on the nerve plexus surrounding the aorta, producing a deep backache with no musculoskeletal cause. It is characteristically worse when lying flat, and partially relieved by leaning forward. Research in the Journal of Clinical Oncology identifies back pain as one of the earliest reported symptoms in pancreatic cancer patients, and one of the most consistently attributed to a postural or spinal cause before diagnosis. Symptom 3, unexplained weight loss without dietary change. Losing weight without changing eating habits is consistently attributed to metabolism change in older adults. In pancreatic cancer, the mechanism is metabolic disruption from the tumor itself, which impairs digestion and drives systemic inflammation that raises the body's caloric consumption. Research published in Cancer identifies unintentional weight loss of more than 5% of body weight over 6 months as an independent predictor of gastrointestinal malignancy that warrants investigation. Symptom 4, dark tea-colored urine without obvious cause. When the bile duct is obstructed, bilirubin enters the bloodstream and is filtered through the kidneys, turning the urine progressively darker from amber to tea brown. Most people attribute dark urine to dehydration and drink more water. Dark urine that persists for more than a few days despite good fluid intake and that cannot be explained by recent medication or food is a specific finding worth raising with a doctor promptly. Symptom 5. Pale, greasy, or floating stools. When bile cannot reach the gut due to duct obstruction, dietary fat is incompletely digested and passes through in the stool, producing pale or clay-colored, greasy stools that float. This is called steatorrhea. Research in gut identifies pale floating stools as a specific indicator of biliary or pancreatic pathology. Most people attribute this to something they ate or a temporary digestive upset before it persists long enough to concern them. Symptom 6. Loss of appetite lasting more than 2 weeks. Persistent appetite reduction beyond the duration of any obvious illness is documented in oncology literature as a consistent early symptom of upper gastrointestinal cancers. The mechanism includes both physical pressure on the stomach from an enlarging tumor and the systemic metabolic effects of cancer. Most older adults attribute sustained appetite loss to stress, medication side effects, or a natural shift in eating habits, rather than raising it as a standalone clinical concern. Symptom 7. Itching with no visible rash and no explanation. This is the symptom most people would never associate with the pancreas, and the one most consistently mismanaged before the real cause is found. When the bile duct is partially obstructed, bile salts accumulate in the bloodstream and deposit in the skin before any visible yellowing appears. The result is generalized itching with no rash, no trigger, and no response to antihistamines or moisturizers. Research published in the Journal of Hepatology and Gut identifies this pruritus as a symptom that frequently precedes visible jaundice by weeks and is most often treated as eczema or dry skin during that interval. Symptom 8. New onset type 2 diabetes after 60 with no obvious risk factors. The pancreas produces insulin. A tumor growing within it can disrupt insulin production directly, producing new onset diabetes in someone who had no prior metabolic history. Research published in Diabetes Care and referenced in the New England Journal of Medicine identifies new onset diabetes in an adult over 60 without the typical risk factors as a potential red flag warranting pancreatic investigation. This diabetes often appears months before the tumor is large enough to be detected on standard imaging. Symptom 9. Persistent low-grade nausea without an obvious cause. Low-grade persistent nausea that is present most days, does not respond to standard measures, and has no clear gastrointestinal explanation is documented in oncology literature as a common early symptom of upper gastrointestinal cancers. Most patients describe it as a general unsettled feeling rather than acute nausea, which is why it is rarely reported with urgency and is most often attributed to medication side effects or stress. Symptom 10. Sudden inability to digest fatty or rich foods. When the main pancreatic duct is obstructed, digestive enzyme production falls, and fats and proteins are incompletely processed. Foods previously tolerated without difficulty now produce bloating, discomfort, and a heavy fullness after eating. Many older adults interpret this as a natural shift in digestive capacity with age, and quietly eliminate foods from their diet without investigating why the change occurred. Combined with pale floating stools, this pattern specifically points toward impaired exocrine pancreatic function. Symptom 11. Fatigue that does not improve with rest. Cancer-related fatigue is qualitatively different from ordinary tiredness. It is present in the morning before the day has produced any cause for it, does not resolve with sleep or a rest period, and accumulates over weeks. Most older adults normalize progressive fatigue and attribute its worsening to age, medication, or a difficult period. When fatigue of this character is present alongside 2 or more other symptoms from this list and has been continuous for more than a month, it belongs in a cluster raised with a doctor. Symptom 12. Unexplained blood clot in the leg or an unusual location. Pancreatic cancer carries the highest risk of venous thromboembolism of any solid tumor. The tumor releases substances that activate the clotting cascade throughout the circulatory system. Research published in Blood and referenced in NEJM cancer reviews documents that deep vein thrombosis, or pulmonary embolism, may precede the pancreatic cancer diagnosis by months in a significant proportion of patients. An unexplained blood clot in an older adult without other obvious clotting risk factors warrants investigation of the underlying cause, not only treatment of the clot itself. The protocol for this list is a triage decision, not a daily habit. If you recognize one symptom from this list in yourself or someone you know, note it specifically, including when it started, and monitor it. One symptom from this list has dozens of explanations, most of them benign. If you recognized 3 or more symptoms from this list, present simultaneously in the same person over the past 3 to 6 months, that cluster belongs at a doctor's appointment this week, not the next scheduled slot. This week, bring a written list of which symptoms, when each started, and how long it has been present. Ask specifically for a CA19-9 blood test and an abdominal CT or MRI. These are not routine investigations, and they will not be ordered unless you name them. CA19-9 is a tumor marker used in pancreatic cancer assessment. It is not a definitive diagnostic test, but it is the specific clinical starting point when the symptom picture warrants it. 2 things in the comments before you go. Write the number of the symptoms from this list that you recognized, just the number. Then, write one sentence about who you were thinking of while you watched this video.